So for this section, we're going to be talking about perioperative nursing. This includes 4 different care areas that nurses work in. The first is the pre-op area. Then we have the intra-op, or everything inside the OR. Then we've got post-op, or the PACU, which stands for Post-Anesthesia Care Unit. And then we've got way post-op. This is kind of like a general med-surg floor that takes care of primarily surgical patients. So we'll talk about the risks associated with those types of patients. The rest of this section is going to be about some general overview type things around the OR and OR patients. So first thing we need to talk about is elective versus non-elective surgeries. Elective surgeries are things that are planned events. It's on your schedule. So like next Thursday, somebody's going to have surgery on some part of their body. These types of surgeries are planned. They usually start in a surgeon's office where a lot of the teaching and a lot of the preparation for that surgery has taken place. A lot of blood work, consent has all taken place outside of the operating room or outside of a hospital setting. Patients are admitted to a facility, whether it's an outpatient clinic or a hospital, the day of their procedure. A lot of kind of elective surgeries are what we call same-day surgeries, ambulatory or outpatient surgeries. Same, it's 3 different ways of saying the same thing. Very rarely, or for different types of procedures, they can be inpatient surgeries where patients will stay in the hospital. The easiest way to differentiate kind of inpatient versus outpatient is where's the patient going to sleep? If they're sleeping in the hospital, they're an inpatient. If they're sleeping outside the hospital, they're going to be an outpatient. Our other big category of surgery is non-elective surgeries. These are usually unplanned events. So patients who experience some kind of medical emergency or a trauma, or something has happened in their course of treatment where it becomes clinically necessary that we have to do surgery on that patient. These patients are usually admitted to a care facility at the time of their emergency. And usually because this was an unplanned event, something bad has happened to them in their life, they're usually going to be staying inpatient for the duration of their recovery and to make sure that we've actually corrected whatever medical problem led to them needing to have a surgical procedure at that time or during that occurrence. Next thing we're going to talk about is all the different types of surgeries that patients can have. So the reasons they could have surgeries. So the first category is diagnostic surgeries. These are where we're looking to extract a piece of tissue from a patient in order to confirm or give an actual medical diagnosis for a patient. A lot of times this type of surgery is something like a biopsy. So we're going to remove a piece of tissue from a patient, and a pathologist is going to look at that in a laboratory to confirm what type of cells have been removed so they can give a definitive cancer diagnosis for a patient. Next category is preventative surgery. This is to stop something from getting worse. So an example of this can be, is very common in women who have the genetic predisposition for breast cancer. They could have a preventative double mastectomy if there's a very high likelihood that they could develop breast cancer sometime in their life. Then we have curative. This is to eliminate a disease process. So if a patient has a tumor, we're sticking with cancer because that's a big reason that patients do have surgery. Curative type surgeries is elimination of the disease. So a lot of times when tumors grow, they grow and they're what's called encapsulated, meaning that they're in kind of a nice little area and they're not diffuse and spread throughout tissues. If we can remove that loculated or encapsulated tumor, that's a curative type of surgery because as soon as we remove all that tissue, the disease process has been eliminated. Then we've got palliative surgeries. These are to relieve distressing symptoms that patients are experiencing. So just like palliative care, where our primary goal is quality of life over quantity of life, for palliative surgeries, we want to improve the quality of life that a patient is having. So these can be things like partial tumor resections. Oftentimes for patients with cancer, when the tumors start to grow, they start to push on other organs or push on other body structures, which can cause quite a bit of pain for those patients. So a partial tumor resection, in order to decrease the mass of that tumor, could be a surgical procedure that can cause more good than harm for a patient. That may cause a lot of pain relief for that type of population. Next is exploratory surgery. This is the kind of surgery that if anybody ever approaches you and says, we'd like to do some exploratory surgery on you, the answer is no. No, thank you. I would not like to have exploratory surgery. This is when we're trying to figure out what in the world is going on with a patient. We don't know exactly what's going on, but let's open you up and take a look, kind of thing. These are patients with very large incisions typically. Like for abdominal exploratory surgery, it's like sternum to pelvic area. They're very long. They just want to open it up and hope that by visualizing somebody's anatomy, they'll be able to figure out what's going on to cause a clinical presentation or to cause a patient's symptoms. Then there's cosmetic and reconstructive surgery. There's two pieces to this. The first piece is exactly what you think it is. It's outpatient procedures to alter a person's appearance. The other type is we do see in hospitals. It's typically done by plastic surgeons. So it's any type of surgery that reshapes body structures. So some examples of this are like cleft palate repair, which is a reconstructive surgery for kids, but it's reshaping their body structures. Another big one is around wound care. So patients with very advanced wounds, like stage 4 wounds, things like that, a plastic surgeon will do a procedure called a wound flap, where they surgically close that patient's pressure injury. And that is a reconstructive or cosmetic surgery that is being done on that patient to close that advanced wound. Next are the different type of surgeries that patients can have. So these can be open, laparoscopic, or robotic type surgeries. Open surgeries are exactly what they sound like. We're going to open a patient up and stick our fingers in there and see what's going on. And by we, I mean like surgeons are going to do that. Nurses, we don't stick our fingers in people. That's creepy and weird. So this uses one large incision. So usually these can be up to 8-inch incisions, so like a full abdomen or like across a knee for an orthopedic surgery. But it's those incisions that you're used to seeing on patients where you're like, oh yeah, they've had surgery, where it's a big, long scar line, that kind of thing. It starts off like this, where a patient's skin is retracted open. People are sticking their hands and tools inside somebody in order to repair whatever damage there is to their structures, to their body structures. Because these are the most invasive surgeries that patients can have, there's the greatest risk of complications for surgery associated with this type of patient. Then we've got our laparoscopic surgeries. This is also what's considered minimally invasive surgeries. The reason it's called minimally invasive is because we're only using 1/2-inch long incisions. There's a few of them on the patient's body, but we're not doing those very large, long incisions and sticking our fingers in there. Instead, we're doing these small 1/2-inch incisions, and then we're putting tools into a patient's body so the surgeon can manipulate those tools internally to complete the surgery. So one of the tools is a camera. So this is what the surgeon is looking at in order to do the procedure. And they're manipulating these tools, which are like little grabbers, like that kids have, you know, those little like hands on a stick kind of things. And each one of these tools does a different job. So some of them are cameras, some of them are for cutting, some are for grabbing, some are for sewing, different tools for different purposes. But for the patient, this is considered a minimally invasive surgery because our recovery time is much faster with these smaller incisions. On the abdomen is a common place that laparoscopic surgeries are done. And what this looks like is like the 5 on a dice, where it's like 2 up top, 2 down low, 1 in the middle. And they're very, very small incisions. Usually they're not even sutured shut. Rather, they just have like steri strips over them in order to just close the skin. And steri strips are just like medical masking tape. It's very cheap and it just kind of falls off on its own after a couple days. Then we've got robotic surgery. This is by far the full sci-fi weirdest type of surgery. So when I was in training, I worked at a hospital that they pioneered this kind of surgery in patients, and it's called a Da Vinci robot. This is the surgeon right here who's got his head in this like virtual reality kind of thing. It's like a wraparound screen that they can see what's going on inside the patient. And this right here is the robot doing the surgery. These two people are surgical assistants who are kind of helping the robot to do the procedure. Good things and bad things associated with this. The good thing is it's a minimally invasive surgery. So it works kind of like a laparoscopic type surgery. Also, the person doing the surgery does not have to be in the same place as the robot who's performing the surgery on a patient. What I saw in practice is the surgeon who was doing, we did prostate surgeries with the robot. The surgeon was in New York doing surgery on a patient with a robot that was in Phoenix, Arizona. So you have very, very long distances between who's doing the procedure and where the procedure is being done, which is great when you think about patients in rural care settings who don't have access to a lot of physicians. So that's fantastic for them. It's horrifying for anybody who's ever seen a sci-fi movie where robots take over the world and start hurting people, because that basically is kind of like what's going on here. It can be a little creepy. One thing that absolutely has to be present for all robotic surgeries is there does have to be a surgeon in the room while this is going on to step in case the robot goes full freak out mode and starts going sci-fi movie on people. So these are the narcolepsy slides. These are going to be throughout our presentations all semester. They're in here to remind me that you guys are probably ADDing out by now and sick of hearing my voice, and it's time for a break. So these are in here to kind of prompt us that this is the end of this section of the presentation, and we're going to take a little break before we get into some more material.